Stergiou-Kita is an assistant professor of the Department of Occupational Science and Occupational Therapy here at the University of Toronto. Mary's work aims to bridge the gap between health and employment contexts and enhance return to work outcomes for injured, ill, and disabled workers. Mary has led the development of 2 interprofessional vocational evaluation guidelines in brain and burn injuries, has explored workplace accommodations in brain and electrical injuries, and has explored the role of gender in the workplace and health and safety, and has now focused her attention on cancer. So no further ado, I would like to turn to Mary for today's presentation.
Thank you. Thank you for that introduction, and thank you all for joining today. What I hope to do is actually get through the presentation in about 20 minutes, half an hour, and really open it up for us to have some further discussion. Because for me, the whole area of cancer is fairly new, and I feel that from that discussion, I can also learn a lot from all of you with regards to the cancer piece of it all. So just to start off, oops. Went too far. Just a little bit of a presentation outline. What I'm going to start by doing is actually just giving you a brief introduction to some of my interests in program of research and now how I think about work. I'm then going to tell you a little bit about some of the projects that I'm interested in with regards to cancer and work more specifically, and then finish off the presentation with some more detailed discussion about a qualitative meta-synthesis I was involved in leading with a group of other researchers where we looked at survivors' work experiences with a goal of really being able to develop strategies to facilitate return to work. So how we could use what we already know to develop some strategies to facilitate return to work. So then in the next slide, what I just wanted to illustrate was a little bit about where my research interests and research goals come from. So I am actually an occupational therapist by profession, and I had worked as an occupational therapist for 15 years before coming back to do my graduate studies. And most of my clinical experience had been in the area of brain injury rehabilitation, and then probably the last half of my clinical career, I specifically focused on assisting individuals to return to work. So most of the focus was on vocational rehabilitation. And what I then wanted to do is expand on that and came back to do my graduate studies to develop some research expertise. And most of my research expertise includes expertise mostly in qualitative research, a little bit in quantitative research, guideline development. I've done some work on consensus building, knowledge translation, and a little bit of work looking at more from a clinical evaluative perspective. And what my overall aim is to use that clinical experience, and I think a lot of my questions or my work was driven from a lot of the questions that came up within my clinical practice, combine it with my research expertise to essentially develop practical strategies and tools that would facilitate work reintegration. And I think the overarching kind of push for me, or the drive for me, is this whole idea of enhancing inclusion. So inclusion of individuals across rehabilitation populations within the context of the workplace. So when I think about enhancing work reintegration, I often think about work as something that happens on a continuum. So that there's a sense of, you know, what's happening with individuals when they're off at work, what happens when individuals during the initial kind of return to work or when people are back to work, and then what might happen or what might be relevant to their abilities to actually maintain their work or maintain their engagement within the workplace. And what I've done in terms of thinking about that is thinking about how while people are off work, that some of the most important questions that we can often ask is a bit around how we help evaluate their work readiness and how we help evaluate their potential to return to work. And once they're back at work, what I found tends to be the most significant piece of the puzzle is being able to assess how they're actually managing at work and what their work performance is like, the workplace supports and accommodations that are put into place, and especially from a work maintenance or long-term perspective, some of the how the supports might be relevant and any issues that there might be at the workplace from a health and safety perspective that need to be considered. When I did my PhD work, most of my work was focused on the whole idea of what types of tools might be necessary to facilitate individuals' ability to re-engage in work again. So the types of things that might help while they're off work. And as John had said in the introduction, I have developed a couple of guidelines, interprofessional guidelines, that look at specifically around voc evaluation and work readiness determinations and traumatic brain injury first, and then the second one in severe burn injuries. And in relationship to back to work, have explored the whole idea of employment success and the role that workplace accommodations can play in that, and also looked at some issues of kind of gender around workplace health and safety. And just to go a little bit into some of my interests more specifically in cancer and cancer survivorship, we have just started a study where we're looking at cancer survivorship and successful return to work, specifically focusing on the role of workplace accommodations. And in this particular study, it's a qualitative study, and what we're looking at is understanding the concept of returning to work and workplace accommodations from 3 key stakeholders' perspectives: survivors, healthcare or vocational service providers, as well as employers, with the eventual kind of goal of developing some sort of guidance or strategies for best practices in relationship to accommodations and the processes that may be most relevant to ensure kind of successful employment outcomes. And so what we're doing is we're interviewing survivors and asking them questions around their experience with return to work, how they decided when they were ready to return to work, how they went about requesting accommodations and asking for accommodations, and whether those were successful or not. We will also be interviewing healthcare providers and vocational service providers, and this may include healthcare providers such as OTs, physios, psychologists, perhaps physicians as well. It will include rehabilitation counselors who work within the context of insurance companies, and also anybody who's assisting from more of a community type of context, and trying to find out from them how they support return to work decision making, how they go about putting accommodations into place or recommending accommodations and putting them into place, and to learn a little bit more about their successes and challenges within those processes. And last but not least, we'd like to be able to interview some employers to get a sense of their experience in supporting individuals with cancer to return to work, what some of the challenges may have been, and what they did to ensure accommodations were put into place. So that's the one study that we're currently kind of looking at in terms of understanding workplace accommodations. The other thing that I'm very interested in, and particularly even more so interested, because in the last presentation a month ago that Dr. Jennifer Jones did, we had some discussion and some issues that kind of came up around the fact that there are a few guidelines at this particular point in time that professionals can use to determine somebody's work readiness and to actually evaluate and plan for their return to work. So one of the things that I am interested in is looking at doing a literature review, synthesizing that literature review, and developing a guideline with recommendations for work evaluation and return to work planning. From what I've been able to gather, there are quite a number of guidelines for screening, diagnosis, and more medical treatments, but not necessarily a comprehensive guideline that would specifically look at return to work. Oops. And last but not least, in terms of being able to develop some understanding of how individuals perform within the context of the workplace, because there are lots of studies that suggest that performance can be affected following cancer for a number of different reasons. I've worked together with some other collaborators at the Princess Margaret Hospital, at McGill, and in Ottawa, and what we're hoping to eventually do is see if we can garner funding to be able to develop a tool that would look at measuring work performance specifically at the workplace. So I'm going to just kind of step back a little bit. So that's kind of the background information, and just share with you now a little bit about what we found within the context of the meta-synthesis that we completed. So this slide just provides some background information in terms of how I typically think about the elements or the factors that can actually affect return to work following any kind of complex injury or illness. And I think for me, I conceptualize cancer survivorship as an example of that. So there may be personal personal factors within the individual that may impact successful return to work. There may be factors within the occupation itself or the specific job demands, and there may be factors from a support perspective in terms of work supports that can be provided in the workplace, and also supports that can be provided within the community, or personal supports that an individual can bring in themselves. And it's often being able to understand the interaction between that and where they come together more specifically in the Venn diagram that I think is important to that kind of understanding. And when we look more specifically at some of the literature in cancer survivorship, there are a number of personal and environmental factors that have been identified as being related to successful return to work following cancer. So on a personal level, at the level of the individual, it can include demographic factors such as age, someone's sex or gender, their educational level, any premorbid health conditions, premorbid or also comorbid health conditions that an individual might have, and also the effect of persistent symptoms such as pain, fatigue, cognitive dysfunction, and anxiety and depression on somebody's ability to return to work and perform when they return to work. From an environmental perspective, it can include things such as support, advice, and services from health and vocational service providers, and from a workplace supports perspective, it can often include a sense that an individual has about whether they're accepted or not back into the workplace, any feelings that they might have had or experiences around discrimination, and processes in relationship to how accommodations may or may not have been put into place. So I'm going to tell you, I'm just going to share with you a little bit about, at this point, what we did with regards to the qualitative metasynthesis, and for just a brief little kind of background on what qualitative metasynthesis is for individuals who may not necessarily be familiar with it. So essentially, a qualitative metasynthesis is a qualitative approach to pooling or bringing together findings and then analyzing those findings that we find across qualitative studies. And typically, when we look at kind of pulling these findings, what we're doing is using methods consistent with more interpretive types of sciences. So what we do in a qualitative metasynthesis is try to move beyond the aggregation of findings, so a little bit less of that kind of narrative, just a narrative review of this study found this study found this study found this, but to look at the links between those particular findings and develop more higher level kinds of interpretations or higher level themes that we see emerging from those studies. And the whole aim is really, as opposed to just using data from one study, using the interpretations from a variety of studies to develop new insights or to kind of advance knowledge. So we're really looking at the findings or the knowledge pieces from each of those studies. And so in this particular metasynthesis, what we wanted to do was look at kind of looking beyond synthesizing individuals' lived experiences. What we found when we looked at the literature was that some syntheses had been done looking at understanding what people's experiences were with living with cancer and the return to work process. And many of these had identified the importance of work following cancer and were able to identify some of the support elements. But we wanted to go a little bit deeper, look at that data in more depth, and specifically be able to identify some of the key points in the recovery trajectory where supports and strategies became most relevant to facilitating successful return to work, so that we could actually talk about specific recommendations for health and vocational service providers. And our actual metasynthesis was guided by the following four related questions, interrelated questions. So how do cancer survivors describe their return to work processes? What strategies do they employ to return to work or maintain employment and navigate health benefits and employment systems? What challenges do they experience, example, cancer, in relationship cancer, their work performance and work environment, and what supports do they report to be most relevant to facilitating positive return to work processes as well as positive return to work outcomes? And so the method that we followed included, so the steps included, first of all, identifying what our synthesis questions were, as the last slide indicated, identifying inclusion-exclusion criteria in terms of what we were going to include in the synthesis, developing search strategies and retrieving potentially relevant articles, and based on those search strategies, once we identified studies that we thought were most relevant, assessing their quality, and subsequently actually extracting data, case data from those studies, analyzing those findings and using what we call a meta-ethnography approach, which is a three-stage approach that I'll describe to actually synthesize and develop recommendations. And because we were looking at the qualitative research, we only included studies that use qualitative methods, and we actually included studies that had something to say about the whole kind of return to work process. So it may have been decisions initially related to whether someone felt comfortable or ready to return to work, the initial return to work process when they initially return to work, as well as any studies that may have spoken about employment maintenance. We included studies where it was cancer survivors themselves that were sharing their experience, as well as service providers. So we included both of those perspectives. And really, because none of us on the actual research team were able to review studies other than in English, we focused mostly on the English language studies. And what we found initially with our search was we identified 2,409 articles using a specific search strategy, 40 of which, after we employed inclusion and exclusion criteria, were potentially relevant. When we looked at it in greater detail in terms of the depth of the information in there, we were able to eliminate some more studies, and so there were 48 studies that specifically fit our inclusion and exclusion criteria. And following the quality appraisal, we removed some studies because we identified them as lower quality, and 39 studies in total remained from which we did the full data extraction and analysis and synthesis on. In this next slide, I just wanted to describe to you a little bit about what that meta-ethnographic kind of approach looks like in terms of analyzing and synthesizing the data. So it involves 3 steps. So in the first step, what we do is we identify first-order concepts, and they tend to be fairly concrete indicators of things we actually see in the literature. And in this particular case, we identified 25 categories or themes of information that came out with regards to that return-to-work experience. These were then organized into 4 key categories. And what I'll be sharing with you in the findings is more specifically some of the elements of those 4 key categories, and then those were then interpreted in relationship to what they meant for practice in that third-order interpretation stage. Categories, so there were 4 categories of discussions related to return to work following cancer. There was discussions in relationship to the post-cancer experiences of work. There was discussions in relationship to managing work decisions and planning to return to work. There was discussions related to the factors associated with successful return to work. And there was discussions related to disclosure and challenges with disclosure and decisions to kind of disclose or not disclose. And in relationship to the experiences with return to work, what we found was 2 very interesting themes that came out, and to some extent would initially appeared like they were juxtaposed to one another. So the first was something that we've read a lot about, and I'm sure most people are familiar with, is this idea about the importance and significance of work to cancer survivors. And the significance of work and the importance of it was identified from a number of different perspectives. So first and foremost, there was lots of discussion about, for many people, the financial need to continue to work. The importance of work was also discussed from the perspective of it allowing individuals to cope. And to be actually, to some extent, distracted from just managing the patient role. There was a huge desire to return to work from the perspective of individuals wanting to return to normality, or for their life to return to normality. And for a lot of people, the whole work experience provided them with structure, relieved boredom. And for a lot of people for whom the work role was specifically very, very relevant, that returning to work allowed them to recapture what their own kind of identity as a worker. And for lots of other individuals, there was lots of discussion about the importance of work for a sense of social belonging. And I think lots of these specific indicators around the importance and significance of work are similar to what we find in a variety of different other populations. So they're not necessarily that different from what I've actually read about or heard about or seen about in relationship to, for example, individuals who have had traumatic brain injuries. But what was interesting was that there was always this background about the significance of work, but also the importance of being able to reevaluate the importance of work in one's life. So there's seem to also be lots of discussions about how the meaning of work can change following cancer, and the need to reevaluate one's life and one's goal, to reevaluate the role of paid work in one's life. And for a lot of people, they indicated that it was very important to seek less stressful work. And for a lot of people, even for individuals for whom work was very important and they found lots of meaning from their work, some of that meaning in relationship to work could be tempered by the challenges that they face. So, for example, if I am doing my job and I'm performing very well in my job, it may be easier for me to find meaning. And even though I still enjoy my job subsequent to returning to work, it may be that the increased challenges just make it a lot less enjoyable for me, and it may be the struggle might not necessarily be worth it. So there's lots of that kind of discussion about the importance of work, yet also being able to reevaluate the meaning of work following survivorship. In terms of managing work decisions and planning to return to work, there were three kind of key factors that individuals talked about, or three processes that they thought were really relevant. So one was the importance of being able to time and determine when one was ready to return to work, and this involved someone being able to self-assess their work, their health status in relationship to their ability to return to work. For some individuals, timing and readiness was also, and the decisions to return to work was also sometimes based on a sense of loyalty to their particular employer, and for others, sometimes it was in relationship to them viewing return to work as a next natural step in terms of that process. So why wouldn't I return to work if I'm better? I should be able to go back to work. From an economic perspective, lots of discussion, especially for individuals who had limited benefits or no benefits. The decision to return to work was often based on the adequacy or often the inadequacy of sick leave time, how many benefits they might have. And for some individuals who are self-employed, while they describe in some cases more flexibility around their ability to return to work and manage their work tasks, for a lot of people, they often felt that they needed to return to work, perhaps often before they were ready, because they were the boss. They had to actually run that particular company or whatever business they might be involved in. And last but not least, there was lots of discussions about the perceptions with regards to the importance of support. So workplace supports in terms of emotional support from supervisors and coworkers, accommodations that might be put into place, social and family, and transportation came up as a big instrumental kind of element to supporting them in returning to work. And from a professional perspective, one of the things they found was most relevant was the advice that professionals could give to them in relationship to work readiness and in relationship to what job modifications would need to be made once they return to work. And factors that they identified associated with successful return to work from a personal level, it included the symptoms that persistent symptoms that they may continue to be experiencing, what they perceive to be their work abilities, how they felt they may be able to cope, and how motivated they felt in terms of the whole kind of idea of returning to work. From an environmental perspective, once again, it was the workplace, the social, family, and professional supports that they identified as most important. And from an occupational perspective, they talked a lot about the type of work and work demands and the amount of control they might have over that job in terms of the job flexibility. And I think the job flexibility piece is probably very associated with the ability to implement workplace accommodations at the workplace. And last but not least, there was discussions around issues related to disclosure of illness. And so this interplay between needing to disclose in some cases, or in some cases the disclosure may have already happened if people already knew why somebody was away from work, but this whole idea of needing to disclose in order to be able to access any of their benefits that they needed and request accommodations, while also feeling that they might want to conceal certain elements of their challenges or not disclose at all because they were afraid of the comments that might come through, how they may be looked at, that they may be discriminated against and ostracized. So lots of discussion around the whole idea of disclosure of illness also comes through. And just to give you a sense, and I think in the final meta-synthesis, we did make some specific recommendations from a practice recommendation perspective, but just to give you a sense of some of the third-order interpretation that we developed in some of the subsequent needs or recommendations was we felt that there was the importance of really being able to identify that there can be great variability in the importance that individuals actually put on returning to work following cancer. So hence there was a real need to kind of explore the meaning of cancer, the meaning of work following cancer, and really to develop individual goals. And that goal setting should be done fairly early in that rehabilitation process. Seems to be a great need for assistance to navigate the cancer and return to work journey. And lots of survivors talked about the importance of public awareness, specifically around persistent symptoms around fatigue, lymphedema, and cognitive issues. The need to have greater information with regards to income replacement benefits and accommodations. The need to really have a sense of to what extent their health issues might affect work performance. And this was actually something that both survivors and professionals identified as a challenge. Knowledge about accommodation legislations and information and education about how to disclose. The need for health professionals to actually assist survivors with determining work readiness, and the need for health professionals to make really appropriate recommendations about schedules and workplace accommodations. So just to give you a sense of just a kind of thinking about the limitations and how we kind of interpret this evidence. So we did find a few limitations specifically to the evidence and also specifically to our review. So to a large extent, most of the studies we had in our sample focused on middle-aged breast cancer survivors. Most of the focus also tended to be, or a tremendous amount of the focus tended to be on personal issues versus workplace and employer kinds of supports. And the focus, a lot of the focus was also more specifically on the early return to work experiences versus looking at elements that may be more relevant to employment maintenance phases. And I think this is particularly important because I think what we do know from other bodies of literature and work is that while levels of impairments might be more relevant to understand during the initial phases of return to work, understanding what happens at the workplace and workplace supports, because to a large extent maintenance of work happens in a work context, in an employment context, and not in a health context as much, requires us to understand what actually happens in the workplace, and I don't think we have as much of an understanding of that. There seemed to be a limited examination of the role of occupational demand, so there's personal elements and environmental elements were talked about, but the job demand pieces and understanding that wasn't, and little application of theoretical perspectives to really assist with interpretation of study findings. And so recommendations for future studies that we came up with was the whole idea of being able to look more longitudinally or down the road and using longitudinal study designs to look at work experience. The whole idea of being able to kind of increase diversity, so looking at diversity of cancer diagnoses that might be researched, diversity of individual socioeconomic status, because the financial piece seemed to be very relevant, diversity in relationship to sex, gender, and even geographical diversity in terms of understanding services that may be available to individuals who perhaps may vary in relationship to whether people are getting services in an urban as opposed to rural context. The influence of the job category and work demands was something that we thought was relevant. And the other thing that we found, at least I found very, very interesting, was the whole kind of idea of discrimination against cancer survivors. And what we have actually initiated, we have a couple of occupational therapy students here in the program, and as part of their actual MSc OT program, they need to complete a research project, and we have 2 students who are now looking at, they started completing a scoping review looking at workplace and stigma and discrimination in working age cancer survivors. So we're hoping to learn a little bit more about that. So I am done with the formal part of the presentation. So I thought, I open it up to questions and any ideas that individuals might have for future research. And if I'd be happy to even talk about the new accommodation study we've just started now and get a sense of people's potential interest.